Bole. I am a men's health urologist at the Cleveland Clinic. That's a good question. I would say primarily it's bother. So if someone is bothered by the amount of time or the lack of length of time it takes to get to climax, you're already approaching the point where your urologist would want to know about this and talk to you about this. But if I had to give it a definition, I would say 2 minutes or less. That's a good question. Currently, we don't have one specific factor that we would say causes premature ejaculation. And I think that's because it's complicated. There are a lot of different factors that can be associated with premature ejaculation. Things like ED, anxiety, prior experiences with sex relationships. All of these things can really play into the amount of time that someone might take to achieve climax. That's a good question. In the medical literature, it would say somewhere between 5 to 7 minutes. But what I tell people, again, is not to focus so much on the exact time, because at the end of the day, we're talking about intimacy. We're talking about making a connection with someone that you care about. And again, I think the primary factor that we look at is it bothersome to you? Is it bothersome to your partner? And that's really what we want to be treating is your level of discomfort with what you're experiencing. In terms of treatments for premature ejaculation, I would say we are very far from having a perfect cure. And that is, again, because we don't have one specific thing that causes it. It's very important, I tell all my patients, to have a multimodal approach to treatment. So that means not just medications, but also working closely with a different kind of health specialist called a sex therapist to really try and figure out, are there any interpersonal factors, emotional, psychological, relationship factors that can be worked on in conjunction with, sure, a medication that your doctor can prescribe. So first and foremost, I think sex therapy. And then getting to pharmacological or medical treatments, yes, there are topical treatments, so numbing sprays or ointments that can be helpful. And then there are oral medications that can be taken. I will say that some of these oral medications have side effects, and so it's really important to have that discussion with your doctor when you're trying to choose exactly what's going to work best for you. There are a lot of myths surrounding ejaculatory dysfunction, and I would say that the majority of the myths are centered around, I must be the only person this is happening to. And I think that's the biggest one I'd want to shatter, is that this is actually a really common issue. Up to a third of sexually active men experience premature ejaculation at some point, in their lifetime. And while it does feel very alarming, I think it helps to know that it's not uncommon. And I think the other thing that helps to know is that it doesn't have to be permanent. In most cases, it is something that is treatable and that can be worked on so that you can get back to where you're feeling comfortable with yourself and with your partner. Communication is really important. Sex is, intimacy is something that is a partnered activity. And so I think it's important first and foremost to communicate with your partner, to let them know that this is something that you're struggling with. And ask them what their perception is. Is there anything that they're bothered by or worried about? Because ultimately, coming back to the treatment portion of it, they're going to want to know about any treatments that you're on, and you will probably find it helpful to get their help with some of these strategies, especially when you see a sex therapist. There's a lot of strategies and techniques that the therapists recommend that are going to take some participation and involvement and help from your partner. So I think communication is really key, and just being very honest. Delayed ejaculation is essentially when someone takes a time to climax that is excessive or overly bothersome to them. People have tried to define it as 25 minutes or more, but I think it can also be when a couple just kind of gives up on sex at some point because it's just too difficult to achieve climax. So again, that goes back to the question of a time that is causing bother in the sexual experience would qualify as delayed ejaculation. it is not as common as premature ejaculation. It's much less common, and I would say to some degree it's also a little bit less understood. I think the understanding of this area is, will need more work in future. There are theories as to things that can contribute to delayed ejaculation. Certainly there are some medications that are clearly linked to orgasmic delay. There are certain conditions that can cause sensory deficits or neuropathic issues where loss of sensation would be clearly linked to when someone started having difficulty with achieving climax. But in many cases, it can also be linked to almost hyperstimulation of the penile area, more so in a behavioral or technique-related manner rather than some sort of medical condition. So that could be part of it as well. Treatments for delayed ejaculation are primarily going to be figuring out if there are any underlying medical conditions that are clearly linked or any medications that are known to cause delayed ejaculations, and figuring out with your prescribing doctor whether there is anything you can do to adjust or mitigate some of those medication effects if they exist. If there aren't any underlying medical conditions that you can identify or any medications that you started taking that could be causing it, then I think the treatment will be primarily behavioral. So again, very important to be established with a sex therapist in conjunction with your medical doctor, your urologist, to figure out a treatment plan that's going to work for you. Certainly there is an association in some cases with a lower testosterone level. So it is important to do hormonal testing, and that would be something to discuss with your urologist or your men's health doctor about whether you might find benefit from treating a low hormone level if you have one. And so the reason behind that is that in certain cases, if your hormonal levels are low, so I'm talking specifically about testosterone, that could potentially be leading to low arousal, low libido, and in that situation, then contributing to some issues with delayed orgasm or ejaculatory difficulty. I think communication is probably the biggest takeaway that I want patients to recognize. It can be very isolating and lonely to experience some of these issues. It can feel embarrassing, but talking about it, with your partner, with your therapist, with your doctor, is going to be that first step to opening up treatments for you in the future. And I think once you realize that there is hope, that nothing about you is broken, and that there are solutions, I really think that's the first step on the journey of getting better and getting towards a more healthy sexual life.